Hi, I'm Dr. Eric Felix. Welcome to Children's Dental Health Associates. I'm sitting here in my Harrisburg office in my hygiene bay, which is pretty representative for any of the 8 offices that you may find. We have multiple themes in different offices, from a space theme to a train theme to a jungle theme. Some offices, like this office in Harrisburg, has a fish or underwater theme. We try to do is bright, friendly, inviting places so not to scare children in terms of being scared of the dentist or having treatment done. All the offices have large open areas for kids so they don't feel claustrophobic in rooms, so they can see other children, what's going on. Any restorative work that's done in the office is all done in private rooms. Each room is decked out with different themes. So here we have, as I said, a fish theme in this office. Every room has TVs available to the kids. Well, it's not just Frogger, that's actually a multi-game. There's 55 different video games on that. So from Frogger to Space Invaders to asteroids, anything any little kid or any big kid would actually want to play, even adults. I think adults are more in my video games than the kids are. Basically, as much distraction as we can possibly do to make them feel comfortable that they're not at a dental office or not having a procedure done, they're not having anything scary done. It's kind of an afterthought to the rest of the experience when they come in. It's all about, again, having fun with the kids. Every patient has an assistant that's assigned to them. The assistant will introduce themselves to the parent, explain what treatment's going to be done, explain to them that they will be with the patient at all times, and they are. So an assistant is assigned to each child at all times within the office. We follow what's called the tell, show, do method. We tell patients what we're going to do, we show them what we're going to do, and then we do it. There's nothing hidden, there's no surprises, and we certainly work with the children, not against them, to try to get treatment completed in a timely, efficient, but most importantly in a manner that doesn't, overly traumatize them or overly scare them. Staying on top of things comes from the type of materials that you use and investing back into your practice. We don't do silver fillings, we only do white composite fillings. We do white composite fillings because they're the most conservative for teeth. Many fillings we can do without having to use local anesthetic, and to the patient it feels like we're brushing their teeth. So it's a much more conservative restoration. The second thing that we do is we invested fully in the digital x-ray. Our feeling being it's worth the investment because we can reduce the amount of radiation exposure to children by up to 90%, which we felt as parents, we felt as with our own kids, that was something that was absolutely worthwhile investing to do. Pediatric dentists go for 2 additional years of training after dental school in a pediatric residency program. We're then trained basically not only how to treat children's teeth, but also how to treat patients or how to treat children in general. We have special training in terms of taking patients to the surgery center, in terms of doing special needs patients, in terms of just how to do children efficiently and effectively so they get the best treatment possible with the least amount of trauma. We take a philosophy that comes from me, that no child here gets anything different as if it was my child. The same materials that go into any patient here go into my kids. The same treatment goes into my kids. So the dedication from the staff is to make sure that the quality is there, to make sure the standard's there, to make sure the kids come out of there and they're doing the best job possible. The basic line for any office is the staff that's at the office. And the staff that we have in all our offices, I think, are fantastic. From the hygienists to the assistants to the front desk to the people even work in the billing department, that everyone cares about kids and making sure that kids here have the best treatment possible.